Jessica Jean McMurtry, this is my video submission 22 of calculating and administering an injectable medication. I am going to be referring to my notes on the computer just to make sure I don't miss anything. We are simulating this video with the stuffed teddy bear dog. His name's Grant Lee. He's being restrained by Jeff over there. Okay, and he's got an IV catheter in his cephalic vein, and we're going to be administering this injectable IV. We're also going to be making use of water for injection because it's not a real patient. Alright, so I'm quickly going to calculate my dosage, and Dr. Lisa, who's taken this video, is going to confirm that I have drawn up the right amount. Okay, so Grant Lee is 6.5 kg, so we're going to be working with that. Alright, the drug that we're going to be administering today is Temgesic. Its active ingredient is buprenorphine, and in Australia it's a Schedule 8 drug. With regards to a Schedule 8 drug, it needs to be locked up and kept in a safe unless it is being used then and there. If you're going to take it out of the safe, there needs to be documentation for you to sign to say that you have removed X, Y, and Z from the safe, and also sign when you return it back to the safe. Okay, so this is the information pamphlet that comes inside the box of Temgesic, buprenorphine. Okay, these are the little vials that we use. When you open them, you are going to flick them, hold them with the blue dot facing you, and actually break it off with your thumb against the blue dot. Alright, so that's that, but we're going to be using water for injection for the simulated video. Okay, my needles and syringes that I'm going to be using. Okay, firstly I'm going to be checking the packages for asepsis. Okay, so making sure that the expiry date is within range. Okay, so for instance, this one is 2024, so we're well within range. And my needle, which is a 21 gauge by 5/8, is, let me just find it, is 2021, so we're also within range with that one. Okay, the reason why we're using a 1 ml and a 21 gauge is because we are going IV through an in-stopper, so it's not going to cause any trauma to the patient, but it does mean that I can draw my medication up quicker and administer it as well. Alright, so that's that. Okay, my calculation, so the dose strength of the ampules is 0.3 milligram per ampule. It's a 1 ml ampule. Okay, that means that my dose in milligram per kg is 0.015 milligram per kg. Alright, and then my dose in mil per kg is going to be 0.05, okay, mil per kg. So I'm quickly going to work it out. The way we work it out is it's going to be, the dose is worked out by milligram, dose in milligram times the body weight, which we said was 6.5, divide the concentration of the drug. Okay, so I'm quickly going to do the calculation on my cell phone. Okay, so we said it was dose in milligram, which was 0.015, times the body weight, which was 6. We said 6.5, eh? 6.5, okay. Alright, that's going to give us that, and then I'm going to divide that by 0.3, which is the strength, which is milligram per mil, and that is going to be 0.325. So there's my calculations, 0.325, and Dr. Lee's is going to confirm it.
That is correct.
Okay, alright, so that's that. Now I'm going to show you how we're going to draw it out aseptically. Okay, so with our needle, I'm going to open it aseptically, but I'm first going to open up our syringe just to make it a little bit easier for myself. Okay, so grab the base of the syringe. Alright, make sure I don't touch the top. And then going to open my needle, connect, making sure I don't touch either side of it. Okay, and then I'm going to uncap my needle, making sure I hold the base of the needle, uncap, and then going to insert it into my water for injection, and I'm going to draw up 0.325. Okay, so there we go, 0.325 drawn up. Okay, and make sure that there are no air bubbles in it. Okay, alright, so that's drawn up. Alright, I'm not going to recap it because the chance that I injure myself is high doing that, so I'm going to administer it straight into the cephalic vein over here. Alright, so Grant Lee has got an import. Alright, so I'm going to insert it into the import, making sure I don't touch the needle tip at all. And I've inserted that. I've given him his Temgesic. Okay, withdrawal, again, no recapping the needle. dispose of it in the sharps container. So the sharps container has a little area that you stick the needle in and you actually pull it out. Okay, making sure that you don't touch or potentially injure yourself in the process. The syringe and needle cap can go into the general refuse. Okay, as can the papers, so that's going to be disposed of in the general refuse. Okay, I'm going to quickly transport Grantley back to his cage. So he's a relatively light dog, so I can lift him in a one-man lift. So there we go, and safely transport him back to his cage. Okay, he's going to be placed into his cage. All right, here he is, nice and comfy in his cage, and securely close the cage behind him. All right, now I'm going to show you how I'm going to clean my surface area. In our practice, we use a disinfectant F10 SC, which is what we use to disinfect all surfaces. This is mixed to a dilution of 1 to 125, which means that in a 500 ml bottle that we use to spray over the surfaces, it's going to be 2 mils in that bottle. Okay, so I'm quickly going to show you how we disinfect. So we're going to remove the blankets where our patient was and any other gross contaminants that might be on the surface. We then clean. All right, we're then going to spray it with our F10 SC. Okay, grab some paper towel, which Jeff has been so kind to hand to me. Thanks, Jeff. All right, then I'm going to clean the surface. Alright, making sure that it's completely clean, and then we're going to spray the surface down again. We're going to leave for the correct contact time, okay, which in this case is 5 to 15 minutes depending on how much time you've got to work with. The blanket we will then take through to the washing or laundry area where it will be cleaned and washed there in the washing area. Alright, so just want to double check that I have not missed anything, so just give me a second. Okay, gloves can be disposed of in the general refuse. Here we go. Cool. Okay, and then just to record what we've given Grantley is on his hospital chart, we then record what medication was given and what time it was given. So in this case, it was 0.325 mils, okay, and it was given at, let's go 20 to 5, so 16. There we go. All right, so that's that, guys.